Good evening. I am Roberto Santamaria, your host this evening for Nantucket Pulse programming, made possible by Nantucket Cottage Hospital's Community Health Initiative. This is an updated edition of the Nantucket Pulse program that will air weekly, covering the coronavirus impacts for our island, and will provide urgent updates as they unfold. I'm here with breaking news on March 30th to amend the March 27th broadcast. After a phone call with the governor on Sunday, the Nantucket Board of Health has been empowered by the state to uphold the coronavirus ban on construction and landscaping projects on the island. Therefore, every part of Nantucket's stay-at-home order is still valid and enforceable, even though it differs from the state's stay-at-home advisory, which does not ban construction and landscaping. At the end of the day, March 30th, the Nantucket Hospital reports 6 confirmed cases of COVID-19 on the island. The Massachusetts Department of Public Health counts 173 cases on the Cape today, and the Martha's Vineyard Hospital has released an updated count of 8 confirmed cases on that island. Accurate counts of Nantucket's positive test results can be found on the Nantucket Hospital's website. Please click the link Read More under the Coronavirus Updates header to find a count that is updated daily around 5 p.m. This episode's guests are Gary Shaw, Nantucket Cottage Hospital's CEO and President, and Dr. Diane Pearl, Chief Medical Officer of the hospital. They answer questions from the community and participate in our rumor report. Additionally, this broadcast features a Q&A session with Chief Pittman from the Nantucket Police Department. And finally, we have a special 10-minute pre-recorded statement from Cassandra D'Alberti, Executive Director of Fairwinds, Nantucket's Counseling Center. We know everyone is experiencing varying degrees of anxiety and emotional challenges. Tess and the team at Fairwinds and Nantucket Pulse are here to help. Starting the week of March 30th, Nantucket Pulse will include wellness shows from our local health professionals on Channel 18 and nctv18.org. These shows will include breathing, meditation, imagery, and movement to help balance our lives during this pandemic. This evening's community updates will begin with the most recent news from Capitol Hill and Beacon Hill affecting our island. Then we will move on to discuss the myriad of resources available to Nantucketers and business owners during this uncertain time. We will wind up the community updates by answering what are the most popular items at Stop and Shop now, and by reviewing some friendly advice about how to cope with all this information. The federal government has just pushed back the tax filing deadline from April 15th to July 15th. The state has launched a new COVID-19 text message alert system. To sign up, text COVID-MA to 888-777. Governor Charlie Baker has extended the closure of the state's school buildings and non-emergency daycare centers from ending on April 6th to now ending on May 4th. New legislation has also eased the following restrictions statewide. Establishments licensed to sell alcohol for on-premise consumption can now sell wine and beer by takeout, as long as the beer and wine is in its original container. Local permits that are currently valid will not expire during this COVID-19 state of emergency. No longer must a hearing on a permit application occur within a certain period. It now can wait until 45 days after the state of emergency. Permits should be filed electronically. Late fourth quarter municipal tax bills due May 1st no longer will incur a late penalty. All municipalities can change their tax bill due date and deadline for property tax exemptions from April 1st to June 1st. The Board of Elementary and Secondary Education can now consider waiving MCAS testing requirements for high school graduation. The Commissioner of Elementary and Secondary Education can now also modify or waive the MCAS testing requirement. More news to follow in the upcoming weeks. As many of you know, Nantucket issued Emergency Order 3, the stay-at-home order, at the beginning of this week. On Tuesday, the state's stay-at-home advisory took effect. Both end on April 6th. However, there is one big difference. The state's order considers construction and landscaping projects part of the exempted essential services. Nantucket's order does not. Due to this discrepancy, the island received a letter from the chief legal counsel to the governor to modify the local order to comply with the state's advisory. In response, on March 25th, the Select Board signed a joint letter to the governor with all 6 Martha's Vineyard towns asking for him to consider preserving the construction and landscaping bans on the island. They argue that because so many workers in these industries commute on the ferries, they could bring infections with them and strain a very small on-island hospital system. The letter described the seriousness of the situation bluntly, saying that, quote, on Nantucket, assuming 15% of those infected will require hospitalization and 5% will need ICU-level care, we could be looking at more than 300 island residents needing a hospital bed and more than 100 requiring an ICU. The islands are also aware that there is a possibility that the hospital's partners in Boston could be at capacity when islands need them the most, leaving the Nantucket Cottage Hospital and Martha's Vineyard Hospital with severely limited or even no ability to transfer patients needing ICU-level care. Moreover, the need for COVID-19 treatment will make acute the need for other types of hospital care acute and further stress an already stressed system. The Nantucket Cottage Hospital President Gary Shaw and Martha's Vineyard President and CEO Denise Shapici have said time and again that given the small size and the geographic isolation of the islands and limited access to PPE and other emergency equipment, failure to limit exposure will necessarily result in the overburdening of each hospital's resources and lead to a further health crisis emergency. Both hospital leaders have further indicated that their ethics teams are now analyzing how the hospital will make decisions as to who should receive treatment and who should not or cannot. This is our reality today. The towns issued a construction ban to ensure that persons who would typically come to the island to work would understand that the islands are not open for business. This ban effectively limits the risk of persons coming to the islands each day who are infected with the virus and exposing others. Emergency work would, of course, be allowed to occur as necessary. Both islands are fervently requesting your help now by modifying the application of your order to provide that on Nantucket and Martha's Vineyard. Construction and landscaping services are non-essential services and must remain closed. If you manage a construction project and you believe it is essential to the preservation of life, safety, and/or property on Nantucket, you may submit a request to the DPW if it's a road project or to the building commissioner if it's a building project. They will review whether or not it merits an exemption to the construction ban. If they agree, they will pass it on to the Emergency Management Committee, which will decide. The hospital has been preparing for waves of COVID-19 patient surges. They have identified at least 42 extra rooms that can receive patients. However, they do not have the staff to attend to all those rooms. They are asking any retired or active physicians, nurses, techs, or anyone who has a medical background that aren't currently working for the hospital to please volunteer as surge staff by calling 508-825-8118 or by emailing the address appearing at the bottom of your screen and in the description. The hospital has been impressed by the community outpouring of donated personal protective equipment like gloves and face masks. Some local store owners have even made their own face masks to donate. The hospital appreciates this generosity and in turn will use these items to help keep the community safe. Please keep it up. They would like to remind you the drive-through COVID-19 testing site is only for patients exhibiting symptoms of respiratory illness and is only for testing of the disease. It is open at the main entrance daily from 9 a.m. to 5 p.m., except between noon and 1 p.m. Results generally can be expected within 48 to 72 hours. They are providing daily updates about island-wide COVID-19 test results at the link appearing at the bottom of your screen and in the description. To help the hospital, the town of Nantucket has asked the Massachusetts Emergency Management Agency for extra security in the form of state troopers or National Guard. The hospital has no security. When they need help, they call the police. By having different departments assist the hospital in needs like keeping traffic and lines orderly, It reduces the spread of COVID-19 within the Nantucket Police Department as well. Already, 1 police officer and 3 EMTs are in self-quarantine. As Nantucket Health Director, I am asking all people coming to Nantucket from a viral hotspot to self-quarantine for 2 weeks. That means no activities outside your house. You should remain separated from people within your house, use a separate bathroom if possible, wear a face mask when in the room with other people, wash your hands thoroughly, and cough or sneeze into a tissue, then throw it in the trash can with a liner. Please understand, the stay-at-home order is not a lockdown. If you are healthy, you may still go outside, but doing so in a group is prohibited. Always keep a 6-foot or greater distance from people with whom you are not living. You may still go outside to walk the dog or for exercise. Please note, the town parks at Nobodier Farm, Delta, and Jetties Beach, the tennis courts, Tom Nevers, and Winter Park are all closed. The land bank playgrounds at Codfish Park in Sconset and 50 Old South Road are closed as well. The wave buses are still running. Each bus undergoes a cleaning and a disinfection regularly throughout the day. Please only ride them for essential reasons, outlined in Emergency Order Number 3. For an FAQ about what this order means, please visit the link at the bottom of your screen and in the description of this video. Thanks to the tireless work of Gregory Pittman and Florencia Rulo, the town's website lists numerous resources for residents and business owners to cope with the outbreak. These links lead to information about what organization is open when given the stay-at-home order. For workers, the link appearing at the bottom of your screen and in the description has information about the following: unemployment assistance for workers laid off or temporarily on break. Please consider applying. Recent changes to this benefit may make it easier to qualify. If you are on break due to COVID-19, you do not need to be looking for work to qualify. This state has waived the 1-week waiting period for benefits. To apply, you need the following: your Social Security number and those of any dependents if you are a citizen, or if you are not a citizen, you need your alien registration number. Names, addresses, and phone numbers of employers for the past 15 months, and reasons for the separation from the employer. The start, end, and any recall dates of your employment, and a banking routing number and bank account number. Support for individuals employing and serving beverages or otherwise engaged in the production, promotion, or distribution of alcoholic beverages can be found on the town website too. The U.S. Bartenders Guild labeled these individuals bartenders and is offering financial support to those that lack the necessities of life due to emergencies like COVID-19. For business owners, the link appearing at the bottom of your screen and in the description has information about the following: a small business recovery loan from the state offering up to $75,000 to Massachusetts-based businesses with fewer than 50 or full-time employees. Nonprofit financial support from the Nantucket Community Foundation and Remain Nantucket. A federal business recovery loan of up to $2 million at 3.75% interest, or 2.75% for nonprofits, called an Economic Injury Disaster Loan. A quick federal loan called an Express Bridge Loan, designed to offer short-term support until more sustainable financing is secured. For all Nantucketers, the town's website provides links to numerous resources to help cope with daily life amidst this outbreak. They can all be found at the link appearing at the bottom of your screen and in the description. For students who need breakfast and lunch, now that they are out of school, Island Kitchen's food truck is offering meals from 10:30 a.m. to 1 p.m. in front of the high school. For Massachusetts residents 60 and over, Elder Services of Cape Cod and the Islands offers Meals on Wheels, food delivery, and in-home supportive services like help with homemaking, personal care, etc. To learn more, please call 1-508-394-4630, Monday through Friday between the hours of 9 a.m. and 5 p.m. For anyone who needs health insurance, the Massachusetts Health Connector announced that open enrollment, which typically runs from November through January, has been extended through April 25th. You can call 1-877-623-6765 or visit the link on the town website to learn more. For every Nantucketer that could use help navigating healthcare, social services, or mental health challenges, the Nantucket Cottage Hospital Healthcare Advocates offer free counseling. They can help you face so many issues like discrimination, mental health, navigating the welfare system, creating advanced healthcare directives, senior healthcare, and much more. This program is a great resource. For reproductive healthcare, domestic violence issues, and nutritional support, Health Imperatives can direct you to the correct support service over the phone. Their emergency domestic violence shelter, Penelope's Place, is still open and can be reached at 508-588-2041. A Safe Place also offers 24-hour advice and support to those suffering domestic violence at their hotline at 508-228-2111. For the food insecure, Nantucket Food, Fuel, and Rental Assistant helps run the food pantry. The location is closed until March 30th, but is still delivering to homebound clients. When it reopens, groceries will be available in prepackaged bags. For Nantucketers over 60 that do not qualify for Meals on Wheels, there is a new free meal delivery service. The Saltmarsh Center, along with Sandbar at Jetties Beach and Or the Whale, are preparing and delivering free meals to seniors. Please call 508-228-4490. Monday through Friday, between the hours of 9 a.m. to noon. For folks looking for mental health and substance abuse counseling, Fairwinds is offering that support over the phone. Gosnold is offering telepsychiatry. For families with autistic children and young adults, the Autism Society of North Carolina's website offers advice about how to talk about the disruption to our daily schedules. For all families with children and teens, Harvard Medical School's website offers suggestions about how best to discuss the coronavirus in an age-appropriate manner. They also have an interesting Q&A about the virus at the link at the bottom of your screen and in the description. Now, let's move on to recent changes to the ferries. In order to reduce the chance for the spread of the virus and to keep island populations from increasing, the Nantucket and Martha's Vineyard hospitals issued a joint statement that appears on the Steamship Authority website to travelers saying, quote, "We are asking you to stay at home. For those island residents, only travel for the absolute necessities, such as food or prescriptions. If you come to the island, you will only strain our limited resources, putting your life and others at risk. If you have a summer home here, we are asking that you stay at your home residence." End quote. To that end, the steamship has decreased the number of ferries traveling from March 22nd to April 8th. At the same time, there has been a massive drop-off in passenger traffic. One police officer describes seeing a handful of arrivals get off on the morning boat when it would normally be disembarking over 300. You can see the full schedule by visiting the link at the bottom of your screen and in the description. The Highline has reduced their ferries to 3 daily round trips. Departures from Hyannis are at 7:45, 11:15, and at 3:05 p.m. First two are in the morning. Departures from Nantucket are at 9:15 a.m., 12:45 p.m., and 4:35 p.m. A spokesperson for Stop and Shop has given NCTV an update on how their grocery stores are doing on the islands. They are currently seeing a high demand in cleaning and paper products, specifically toilet paper. Shoppers are also stocking up on poultry. They said in a statement, quote, "We want to reassure our customers that our distribution center is full of product. The demand that our customers have made in the stores is more than double what we normally experience. It takes time to restock. But we continue to maintain our regular delivery on schedule on Nantucket and are catching up with this unprecedented level of demand." End quote. If a Stop and Shop worker were to test positive for COVID-19, the store would conduct deep cleaning and sanitizing and follow the guidance of the CDC, as well as that of the global, national, and local health authorities. Finally, the hospital has provided some useful advice to the community at large. They offer a reminder that everyone copes differently with stress. Some people might like to joke about it, and others may find those jokes inappropriate. If someone's behavior doesn't match yours, it doesn't necessarily mean they're not taking it seriously. Not everyone is affected equally by this outbreak. Immunocompromised and elderly people are at a greater risk. Poor people are especially affected by stockpiling. You might want to manage your media consumption as well. If the constant barrage of viral news makes you feel overwhelmed, try taking a break. Social distancing does not mean reducing your communication with others. Phone calls, Skype sessions, and emails are a great way to reconnect with old and current friends. Secondary traumatic stress does happen. The stress and disruption the virus causes around you can cause you to feel burnout or compassion fatigue. If you do feel overwhelmed and like you aren't processing stressful situations like you normally do, this could be a sign you have a treatable mental health condition. Fairwinds is offering counseling over the phone. Gosnold is offering telepsychiatry. Minimize maladaptive coping strategies. Increasing levels of alcohol consumption contributes to the challenges like depression moods, and sleep difficulties. Remember, this is a marathon, not a sprint. Take a rest. If you make room for others to rest, they can do the same for you, and the community does better overall. Now let's move on to a statement from Nantucket Cottage Hospital CEO and President Gary Shaw and Dr. Diane Pearl, Chief Medical Officer for the hospital. Thank you both for coming and staying 6 feet apart.
Hi there, I'm Dr. Diane Pearl. We, within just a few days, recognized that we were at grave danger, our community was at grave danger of being affected by this pandemic. And all of our focus changed immediately. We have been working since that time to organize and prepare for what could be a true disaster here on Nantucket. So the entire staff, the leadership of the hospital, and I have been meeting countless times on a regular basis every day, including weekends, to prepare in the best way we can to help this community survive this potential devastating epidemic. We opened up the first drive-through, I guess it is the second drive-through testing site in Massachusetts within days, and have perfected some of the things that, of course, at first are not perfect. The testing in America was way behind what it should have been, and the testing 3 weeks later has improved, and the capacity to test and the turnaround time has improved. We have seen almost 200 patients at the drive-through. We have sent 70 tests for COVID-19, and very happily we have received only 5 positive test results. However, there are others in the community who are infected. We know that just by epidemiological data, and the people who have tested positive did have some exposure to other people. With the new ban on socializing and with social distancing now in order, we have not seen an explosion of positive tests. If these people had been going through life as normal in parties and bars and restaurants and groups and with normal physical touching and activities, we would be seeing an enormously higher number of COVID infections. So we're very grateful that the powers that be, that the government and the hospital endorsed these very important standards for social separation, for hand hygiene, and now for sheltering at home. This virus spreads very easily, extremely easily, and really the best way to combat it is to not give it another host. So we are very happy so far to see that the Nantucket experience is a flat curve. We hope that we can hold on for the long run because, as Roberto says, this is not going to be short. It's going to be several weeks, if not longer, until we understand what's going to happen next. Our President, Gary Shaw, will give you some details about what we've been doing.
We first want to express our gratitude to the Nantucket community for the countless acts of generosity, your goodwill and support for the hospital that we have witnessed over the past week. We thank everyone who's donated medical supplies or took the time to manufacture homemade masks, not to mention the many other offers of food, housing, and funding. Seeing our community rally around its hospital as we respond to the coronavirus or COVID-19 as a pandemic has been inspiring for everyone at the Nantucket Cottage Hospital. As our hospital has prepared for this unprecedented situation and changed the way we do business, we realize that the measures that have been implemented to protect patients and our staff may have created the perception that Nantucket Cottage Hospital is essentially closed to all but those suffering from COVID-19. That is far from the truth, and we want the community to know that we are open and here to care for you. While we have indeed rescheduled things like well visits and canceled elective procedures to reduce the number of people coming through our facility, we continue to see patients at Nantucket Cottage Hospital for urgent non-COVID-19 healthcare needs. We are taking every infection control measure to protect patients and staff and are screening potential coronavirus cases outside the hospital at our drive-through evaluation site at the main entrance. If you have a medical need, please call us and we'll do our best to serve you and your family. Our doctors are able to schedule visits with their patients via telephone as well, and we are working on rolling out video visits. Much more to come in all of those electronic medias. We now have 5 confirmed cases, as Dr. Pearl had indicated, of coronavirus on Nantucket. And these patients are quarantined at their homes and monitoring their symptoms with our clinical team. We thank you for staying at home. As we know, the majority of people diagnosed with COVID-19 have mild symptoms, and we have not yet had anyone on Nantucket become significantly sick or require hospitalization due to coronavirus. But we cannot let that fact lead us to become complacent. We must do everything possible to prevent the spread of the virus in this community. So we continue to urge Nantucket residents to follow all aspects of the town's at-home, stay-at-home order and construction ban. Limit trips to the grocery store, practice social distancing, as well as vigilant hand washing and hygiene measures. The actions all of us take now and in the days and weeks ahead will determine whether we are able to reduce the impact of COVID-19 on our island and avoid a surge of cases that could overwhelm our hospital. We need the help and support of every member of our community to limit the potential spread of this virus. Many people have asked about our plans to care for people who become infected, and we want to share a few details of what we have done to date and what we'll be doing moving forward. You can also find this information on our website, so please go there and look at all of the different writings that are there to help you. We've already implemented numerous measures to prepare for coronavirus patients at the Cottage Hospital. The drive-through evaluation site at our main entrance opened on March 16th and was one of the first drive-through testing sites in the state of Massachusetts. We have identified an internal triage area for patients with suspected cases of coronavirus. Nantucket Cottage Hospital has also created a high-risk zone in the emergency department and inpatient unit that will help isolate COVID-19 positive patients from others, including utilization of negative pressure rooms and other actions, which include we have brought in additional personnel to serve in its emergency department and its inpatient unit. The Cottage Hospital is cross-training physicians and nurses from other units to assist in areas impacted by COVID-19. The Cottage Hospital is bringing in a new respiratory therapist to assist with COVID-19 specific treatments and train additional Cottage Hospital personnel on ventilator use and other respiratory procedures. The Cottage Hospital has recruited auxiliary physicians and nurses to aid in the event of a surge as part of a reserve team. And we've created cohort teams of physicians and nurses to reduce the number of exposed team members if one becomes infected. We're assisting with the town health department's effort to recruit and train tracers. Those are individuals that identify points of contact with confirmed COVID patients and follow up for finding other individuals that need to be followed. Another topic that's generated significant interest is the medical equipment available on site at the Cottage Hospital and personnel protective equipment. We call that PPE for our staff. The Cottage Hospital currently has adequate supplies of PPE based on current usage for roughly 2 weeks, and we continue to receive shipments from Partners Healthcare to bolster those reserves. We do anticipate that our usage will increase, which is the reason why we put out the call to the island and homemakers to make masks and other medical supplies. We wanted to mobilize our community to preclude any possibility of running low or running out. So essentially, we've created a first level, which is normal manufacturing use, a second level, which is what we've asked you to help with, a third level, which is manufacturing our own, which is the masks that we've been getting so many of from the community. Meanwhile, we will use our approved medical grade PPE first and foremost, but continue to accept those supplies from the community. Please keep them coming. 2 items of note with regard to equipment. The hospital has rolled out telemedicine capability in the emergency department and on the inpatient floor so that physicians can communicate and check on COVID-19 patients without entering their room and contaminating scarce personal protective equipment. With the support of Mass General and Partners Healthcare, the hospital has acquired 5 additional ventilators so that we can care for patients who are in serious respiratory distress prior to transfer to a higher level of care. And we are now working very actively with our physicians, our anesthesia group, and nursing staff to ensure that we are using the equipment as well as staffing levels and training with the right expertise to deploy those effectively. That's a large work in process. We've been working simultaneously to solidify plans to transport those patients who may need ICU level care, while also working through options to expand our capacity inside our hospital and on the island outside our walls. The Cottage Hospital's Incident Command has a task force dedicated to surge planning that has been meeting for several weeks, actually since the beginning of January. This surge task force has met daily to develop plans to address all of the issues presented by a potential surge of coronavirus patients, including hospital personnel, equipment and supplies, internal and external facilities, logistics and transportation. The task force has coordinated closely with our colleagues at Mass General and Partners, as well as the town health department and local, state, and regional emergency medical management agencies. The Surge Task Force has developed a strategy to maximize our internal capacity at the Cottage Hospital, if necessary, beyond our licensed capacity of 14 beds. The Surge plan includes 4 phases based on the number of COVID-19 patients requiring hospitalization and methods to increase capacity, including doubling up patients in inpatient rooms and/or utilizing other areas of the hospital, including pre- and post-operative rooms and other areas typically used for outpatient care for COVID-19 positive patients. Our expectation is to transfer any critical patient in need of hospitalization beyond our in-hospital capacity, as well as patients in need of ICU level care. The Cottage Hospital is in regular communication with Boston MedFlight and the United States Coast Guard regarding their operational readiness to transport COVID-19 patients to existing and emergency off-island facilities where there is a critical mass of providers, equipment, and supplies. We have prepared a backup plan in conjunction with the town as well as the state and regional agencies for additional space for COVID-19 or non-COVID-19 patients in the unlikely event these patients can't be accommodated at the hospital or off-island. We wanted to provide this information to demonstrate our planning efforts during this unprecedented situation and to continue to be transparent with you regarding our capabilities and resources. We all, each one of us, have a large part to play during this challenging time. And the best thing that we can do now is stay home, practice social distancing, keep washing your hands, and support each other as much as possible, but at a distance. We thank everyone for supporting us.
Okay, so now we're going to move on to the question and answer session on YouTube. So what we're going to do, if you're looking to pose a question, you have to refresh your YouTube channel first so that the chat will show up on the top right of the live stream. And if you have any questions, please feel free to just type in any questions. But in the meantime, I'll go ahead and ask Gary, how do you feel the hospital has been responding to everything so far? And do you believe that your capacity is in any way strained yet?
Well, I think we've got a building filled with superstars, just like the one that's represented here with Dr. Pearl. You couldn't ask for anything better. When folks see their community distressed or facing, a potential crisis, folks step up in ways that are hardly imaginable in days of just regular norm. They're fantastic people, and we are stressed only in that we are planning so many scenarios and working so many hours to ensure that all of the parts and pieces come together. In all honesty, we get tired, but that tiredness does not equate to lack of capability or lack of readiness. I believe this hospital is more prepared than any place I could ever be in the United States at this point in time.
That's so great, actually. And we have a question that's come into the YouTube channel. It's an infrastructure question. Why are there no ICU beds in the hospital?
Yeah, that's a great question. Well, when you look at how the U.S. is structured related to levels of care, you look at communities and your ability to support those intensive care units with high-tech equipment, telemetry, and people that are trained normally to see a high volume of patients that utilize that equipment. You typically don't build a facility and then only see a few cases a year because you can't keep staff competent in seeing cases that they should be seeing often. Folks, when they're trained out of school, they want to be able to see patients and help individuals. So when you come to smaller facilities like an island, you do create a level of capability for intensive short-term care. And that's what we do have in the emergency room, but it's not designed for long-term intensive care.
Absolutely. Okay. And then in both of your opinions, how will we know when it's safe to come out of our homes again?
I'll give that one to Dr. Pearl.
Nobody really knows because this is an unprecedented event, and we watch it very carefully. There are countries in which they have had surges, which have been devastating to the economy of those countries and devastating to the population. That's what we're trying to avoid in the United States, and some other countries have done it very well by what Gary has been talking about, flattening the curve of this enormous, of a surge of patients. So we haven't seen a surge, we have seen a slow trickle of cases, although in New York City and in Boston they have seen unexpected volumes. So we don't really understand yet when this will be over or how long it will take. But the longer it doesn't have a surge, the more a chance there is for this virus to die. And one person doesn't spread it to another person, that virus is dead. So we can just carry on until we see that the cases are very minimal, and perhaps then things will gradually reopen and we will feel safer.
I'll add, I like to use analogies. That's become a habit of mine over the years. But if we equate this to a storm that's just lurking off the shore, and it's a hurricane and it's a big one, we're just now getting swept by the outer bands. And that's what we're seeing in the low amount of cases that we have. And what we want to make sure of is that as those larger, stronger surges of bands come ashore, that we don't see a rapid influx of growth of cases on the island. You would see a growth, and then you would start to see the eye of the storm and hopefully a depletion of virus. That's the goal, is to flatten it and then basically bounce along the bottom of a river for a little while as a pebble. But if we are too quick to come out of our homes and start socializing in ways we were used to in the past, we run the risk of being hit by the other end of the storm that's going to come over us and then draw another level of infection. And that's what we're trying to prevent. The more we can get this focus out of our community, the better we'll be. So we don't want to be traveling through both sides of this storm.
As a Floridian, the hurricane analogy works very well. We want a tropical storm, not a Category 5. Okay, so the next question is from Jeannie. Are the restrictions still as strict for testing? And are you counting or tracking people with clinical diagnostic cases that don't necessarily meet the testing criteria?
The criteria for testing are still quite strict, but we give our clinicians at the drive-through center complete discretion to test outside of those criteria because they're experienced, and we have in a short period of time gained some experience to understand who's at risk and how they appear clinically. So I do feel that, of course, we should be testing more people, and we are doing that. on a regular basis because it helps us understand the disease, it helps us track the disease, and it helps us understand what is in the community at present. They're not quite as strict, but the strictest criteria is to have symptoms of some kind. So we won't test healthy, well people for this virus.
Okay. Well, indeed, we know that there's a lot of questions that we're not going to be able to get to here. So I'm going to try to get it to about 2 more, if that's okay with you. One more question from Kinsley is, should people who have come here in the past week or so from a hotspot be requested for quarantine, and how would you get the word out to them? I know, just very quick, I'm going to try to do a quick jump in on that. Today, the governor did announce that anyone coming from out of state do a 14-day quarantine. And we do know that at all the rest stops in the state of Massachusetts, that information is being put out. But if there's any other information that you have from the hospital, I would be happy to hear that too.
I'd love to see us follow suit with that recommendation. The best thing that I think people can do now is shelter in place where they are. No matter where you happen to be in the United States, this is not a good time to be working your way through social pools of probably circulating disease and pick it up and carry it to your families, your elderly individuals, grandmothers and grandfathers, and your children. Shelter in place. Watch movies, learn how to spend time with one another again in ways that we just probably have not taken advantage of in a long time. But stay where you are. That's where you're going to be safest.
Excellent. Melissa, I do see your question. Just know that it was answered by Chief Pittman in the next segment, in the pre-recorded one. So I'm going to go ahead and move on. Stay tuned for the way Mr. Chief Pittman answers that question. And then lastly, a follow-up question from Kinsley is, how contagious is the virus in open air? And should everyone try to wear a mask or cover their nose when going to the grocery or the pharmacy?
I don't know that anybody knows about the open air question. However, we do know that it is less likely to be spread in open air because there's airflow and the droplets would be dispersed much more quickly in open air than in a small contained space. So that's why the drive-through is one of the reasons we've chosen the drive-through method. Our architecture of the new hospital also really lent itself to the drive-through through the portico. What was the second part of that?
And should people be wearing masks to cover their nose and mouth?
Wearing of masks is most effective at preventing the wearer from spreading the disease to others. So with this community involvement of this virus, wearing the mask does not necessarily save or protect you as much as keeping 6-foot distance. And for us in the hospital setting, we wear masks just because sometimes people can spread infection before they are ill. And we have to wear masks so not to endanger our patients. The patients don't necessarily wear masks with us unless they have symptoms of infection, but these are all recommendations that change almost on a daily basis. And at the moment, wearing a mask is not recommended for a well person, but that could change next week as well. We do know that 6-foot separation does work because that's the distance that droplets can fall. And we do know that hand washing works because this virus is on surfaces. So those are safer methods actually than wearing a mask.
Excellent. Well, Dr. Diane Pearl, Gary Shaw, CEO of the hospital, I really appreciate you two coming here and taking your time. I'm sure you're incredibly busy, and we really appreciate your process, and thank you very much. Thank you for protecting the community and getting the information out as you can.
So one last parting comment to all of you out there: wash your hands. Have a great night. Thanks for having us.
Yeah, thank you.
Thank you. Okay, so that concludes our Q&A session right now. So we're moving to the rumor report. So actually, really quick, is there any rumors that you have heard? Because I know we've had a couple rumors that have popped up. Anything that you would like to dispel while we're here?
I haven't had time to be in the community to hear any, but if you have, I'd love to hear what they are.
Oh boy. Well, there are plenty of rumors. Some of the big ones, some of the big whoppers out there are that the emergency orders are no longer valid based on what the governor has issued, and we're here to tell you that the emergency orders issued by the local boards of health and the local select board are still valid. We are still enforcing on the construction ban. We are still forcing on the stop work orders. That is a very important part because it is not necessarily that the people you're working with are going to be getting sick. It is that transport of fomites, where like Dr. Pearl was explaining earlier, how when you sneeze and things get on surfaces, it is that transport and that infectivity that we're trying to prevent. Just because you're out doing landscaping or you're out doing construction by yourself on a construction site does not mean that you're not going to get yourself sick or that you can't get others sick. So it is really important to abide by those emergency orders. And then lastly, another big one was unfortunately perpetuated by some of our federal colleagues, but the information on the malaria drug and does that treat this. And as of right now, from our colleagues at the CDC and from Dr. Fauci, he has explained that the malaria drugs, the quinulin that you've been hearing about and all the other types, they show minimal promise, but as of right now, there is no evidence to support that it does treat COVID-19. And unfortunately, that rumor that was spread did cause people to hoard this drug, and it is a life-saving drug, so please do not hoard any of this drug if you have it. And if you can spread this information out to others, please spread that information. So that was really quick, and then really quick ending for the rumor report. So now we're going to move to a quick, what would a Nantucketer do? So what should a Nantucketer do with COVID? We talked about social distancing. We talked about how to not shake hands. What should a Nantucketer do in these days? And so I would say stay home.
How about if we take a couple of yes and no scenarios?
Okay.
Geez, I'm a little tired of being indoors. I want to grab my dog and a couple of friends and let's go for a walk out to the park and probably meet Ben. I can get him on social media and have him meet over there. Would that be a good thing or a bad thing to do, Dr. Pearl?
If you keep your distance from each other, it would be fine.
But a Nantucketer should also understand that you don't always know where they are and where they have been. So make sure that they're safe as well.
Well, maybe a Nantucketer would want to go out and watch the stars and put a tent up on the beach and have 4 or 5 people sleep in and just enjoy watching the stars. Is that something we should do?
As long as you maintain social distancing, if you're in by yourself, recreation is still allowed by these emergency orders. If you are taking proper precautions, if you're going to go see the sunset at Nantucket, we do recommend that it is still yourself and you maintain your social distances, but you are still allowed to go see the sunsets and the stars. Nantucketer would definitely stay inside and be safe in the vehicle. Try not to congregate.
Would a Nantucketer feel that it's safe to go get takeout from local restaurants?
A Nantucketer should feel safe on our streets, especially if they're going to get a food from our Nantucket restaurants. We have issued a curbside delivery request to all our restaurants, a curbside delivery order. A Nantucketer would call ahead with their order, and a lot of restaurants are actually taking payment ahead of time. They will be waiting for you when you get there. If you do get there and they're not waiting for you, give them a call and they will bring the food out to you. Nantucketer always practices safety and safe social distancing. Okay, well, thank you very much. Thank you very much for the rumor report. I really appreciate you being here once again. And I'll let you go back to your busy schedules. I'm sure the hospital needs both of you back. So that would be end with our hospital. Thank you very much, Dr. Diane Pearl, Gary Shaw. We really appreciate it. And we're now going to move forward to our previously recorded conversation and question and answer session with Chief Pittman. First question is from Michael. Given that the schools have pushed back their opening date till May, and the current restaurant opening date coincides with the last school closing, will the restaurants and bars be moved out to the same date? Or do you have other plans for extending the reopening date for the restaurants and bars?
Well, Roberto, the incident management team is taking information in almost daily on direction from public health officials such as yourself, from the state, even from the federal government. And so that decision will be made in coordination with the select board and the Board of Health's recommendations as we move along. I can't set an absolute date when I think it'll reopen. I think it's a week-to-week evolution. As it stands now, they're closed until April 7th, even by state order, by the governor's order. So we'll be taking it a week for guidance from there, week to week.
Excellent. Well, the second question is from Melissa. What steps are being taken to protect the identities and the essential services of those who test positive or those who are sick but not able to qualify for a COVID-19 test?
Well, that's an interesting question. The cyberbullying that's been going on for some people, not just here in Nantucket, but nationwide, is absolutely reprehensible. People don't choose to get infected by this virus. It just happens. If somebody's bullying them, they certainly should report it to the police department. We will look at what is available, and if there's actionable items, we'll do that. If nothing else, we'll reach out to that person if they're identifiable and talk to them. But we would definitely go after anybody that's cyberbullying any potentially infected person with the full extent of the law. At the very least, service providers such as waste haulers, people like that, UPS, different things, they shouldn't deny services to these individuals just because they tested positive or they think they may be positive. They should continue to provide service using the standard precautions that they've all been trained. And if they do that, they'll be fine. There's no direct contact between the individuals that are potentially infected and those service providers when they're doing that. So if somebody feels as if they're being discriminated against for that, they need to call us. We may refer them to the Attorney General's office to have further consultation on the issue, because there simply is not a statute that directly addresses it in most cases. But we'll certainly try to get them in touch with somebody who can or will be able to help them.
Excellent. Yeah, and I know that the direct identity is also protected by HIPAA, so that's really important.
That's true, Roberto. We don't report, and this is not within the purview of this team here. This certainly is more under your purview with public health, but you're reporting numbers by county, not by town, not by neighborhood, not by any other identifiable factor. And as a matter of fact, it's important for the people to know that even though Roberto's on this team, we are not privy to most of that information that's coming in. As a public safety entity, all we're given is just the address of where an individual may be that is tested positive and the reason for that, and that information goes into our computer-aided dispatch system. That way, if they need to call for police or fire or EMS, the first responders can be told that they have to implement PPE, personal protection equipment, to protect themselves and to protect anybody else from further contamination. So it's very well regulated. It's very, that information is designed to protect the identity, and our procedures designed to protect the identity and the safety of the individuals involved.
Very important information indeed. Third question. If an onslaught of travelers comes to Nantucket and an infection starts spreading, how will the police department assist?
That's a difficult question. Right now, under the guidance we've gotten from the state, there's no, the only way that travel can be prohibited is if there's a quarantine order, and that quarantine order has to be done in the presence of or in consultation with the Commissioner of Public Health from the Commonwealth. So it's not just your local Board of Health, it's also has to be done with concurrence and consultation with the Commissioner of Public Health. So if they issued a quarantine order for a particular area because of an outbreak, which is the only reason they would do that, we could probably limit travel. But more than likely, you're talking about limiting travel to a very narrow area. It's more, you're talking blocks instead of a community. Although it would be easy to say, if we shut travel off to Nantucket, nobody could come here, we'd be safe. That's absolutely true. But there's nothing in the law that allows local government or even state government, for that matter, to do that. Everything is more an advisory. And right now, the advisory is that if you travel into the Commonwealth from any place in the world, you need to self-quarantine for 14 days. And that includes if you live here in the Commonwealth and you're traveling from out of the Commonwealth back home, you need to quarantine in place for 14 days once you get here.
It's incredibly important. It's incredibly important. And also, I'll remind everyone that we are in an active EOC, so you're going to see a few people coming back and forth. EOC is an Emergency Operations Center. So the fourth question is, what actions should the town of Nantucket take in this upcoming week? I take it as, what actions are we taking in the upcoming week?
Well, I think most of the emergency orders that are needed to be in place are in place. I think the actions, unless something drastically changes, what you see right now is what we'll be doing in the coming weeks. Now, as things escalate a little bit, which it's anticipated they may possibly do, then we'll ratchet up different efforts that'll be designed to address those particular things that are causing us friction or problems. Right now, we're still enforcing our stay-at-home order. We're still enforcing our construction ban, which includes a ban on the stay-at-home order. By its effect, effectively prohibits activities such as landscaping and things like that. We're enforcing the local and the state stay-at-home order, which prohibits retail establishments from allowing people to come into their establishment or even to their establishment. So, in other words, if you're a retail establishment and you're not an exempt service, you can't say, well, call ahead, we'll hand out the item out the door. That's not permitted under the regulations or the orders that are in place. And if that's being done, you could be subject up to a $300 fine just for violating the governor's stay-at-home order. So, we are answering calls to that effect as of today. We have not issued any citations. We've pretty much got mostly compliance from just asking people. But most of what's going on out there right now are people just not thinking about what they're doing. For instance, we get a call, a group of guys out on a golf course golfing. They're doing what the order allows them to do, and that's engage in some recreation. But they're missing the part about the social distancing aspect of this. And you don't know who is infected. You have no idea. Everybody on this island, I guarantee you right now today, knows somebody that's infected. You just don't know it yet. And that's an absolute fact. We're not trying to scare people. We're just saying you have no idea who's infected at this point. And so any contact is risky contact at this point.
Yes, like Gary Shaw from the hospital says, act like it's already here, because it is. You never know who has it. As far as the state, what do you think the state is doing in this upcoming week as far as enforcement and things like that, and their response to this?
Well, I think the state has come forward today with the order that anybody traveling into the Commonwealth needs to self-quarantine in place. I think we'll see how that unfolds. I know they're putting up information. They're handing out flyers to anybody at airports and terminals, points of entry, railroad stations, things like that. What they're also doing is putting up information flyers on along the Mass Pike or billboards to advising people this effect. I think they'll probably wait and see what we're seeing happening here is we see what's happening in New York City. And we know that many of those people in New York City have come to southeastern Massachusetts, the Cape and the islands over the last few weeks. We'll see how that impacts the overall effort here in the long term. But I think as that starts to unfold, we may see the state having to tighten up some of the rules.
Sorry, I had some technical difficulties with my microphone. As far as the stay-at-home order, how are the police looking to enforce that, or how is the town enforcing it in general?
Well, there's two different sections that we can use for enforcement. Our number one objective is just voluntary compliance. As I said, probably 99% of the people that we've encountered have no idea what it really means, the stay-at-home order. They're out engaged in some activity and, maybe with a friend, they're walking, and what started out to be a 6-8 foot separation turns into just being a couple feet. Well, if they see somebody that's not exercising proper protective measures, they'll stop and just advise them. The officers will stop and just say, hey, just a reminder, you really need to maintain social distance, 6 foot or better, and not prolonged contact. That's kind of the real big thing is the prolonged contact. So, a contact inside somebody's 6 foot circle for 30 seconds is going to possibly have a different result than if you're around them for 15, 20 minutes or 30 minutes. So the officers will remind them of that. If we do get, and we have gotten some calls about some gatherings. I mentioned earlier about some people golfing at the golf course. One person out there running around to golf's not a problem, but when you get a foursome, it is a problem, especially as they're all huddled around the hole or the whatever. So you just got to be very cautious about your social distancing practices. It's so easy to forget, and it's so easy to have good intentions and start out doing the right thing. But as time goes by, you start getting closer and closer and closer and closer, and then you've just undid everything that you tried to prevent to begin with.
Okay. Well, you actually answered a couple of the questions that had been sent in, so I'm just going to skip down to the next one. And what are your thoughts on requesting assistance on the National Guard?
Well, I think there's a lot more drama involved in this request than what really is warranted. What has happened here is the Commonwealth called up the National Guard for purposes of support to local communities in the event that they needed their support in dealing with the coronavirus outbreak. And now they didn't call up medical units. They called up logistical units for moving supplies and military police for law enforcement support. Most communities, use the Cape as an example, there's 15 towns over there. If a police officer in Yarmouth, if Yarmouth comes up short a police officer tonight and they've got a call for help service and they don't have a police officer that can answer it, well, Barnstable can send an officer over to answer that call. They have backup jurisdictions just very close to them to be able to help them with their calls for service. We have nobody here. So we have had to, any backup we have is at best 2.5, 3 hours away, even in an emergency situation. So what we've had to do early on is we've had to implement procedures that would protect the police officers from exposure as much as possible. And the goal there is to try to keep a certain number of them healthy by limiting their contacts. But this has resulted in reduced manpower available for calls. And so we put in a request to the state through the Massachusetts Emergency Management Agency for logistical support, or security support, they call it. And what we'll do is, now the state has responded. They've assigned several extra state policemen to the island. They would be an alternate force that, they're not coming in this building. They're not interacting necessarily directly with the Nantucket officers. So in theory, as I start to lose Nantucket officers to this COVID-19, which I will, that's a given. I've already lost one because of a close contact, and he's in isolation. So we will, or we have to plan as if we will anyway. At least we'll have that alternative. Another point where we're having a real struggle is, in order to limit the exposure to the officers, well, where's the number one place they're most likely going to be exposed? And I know some people are saying the Stop and Shop, and I'm not going to disagree with you on that, because it's kind of the hub where everybody goes. So we urge everybody to use good social distancing practices and wash your hands and everything when you're there. Wash the stuff you get. But anyway, but more than likely, as this thing starts to spike, which it will, we will have to deal with law enforcement situations over at or near the hospital in terms of traffic, potentially crowd control. As the hospital, if it starts filling up with seriously ill COVID-19 patients, family cannot go in there and hold these patients' hands while they're convalescing in bed. There'll be angry family. There'll be family who doesn't understand that. And we'll have to go over there and deal with those types of interventions, because quite frankly, the hospital does not have a security unit. It's always been police officers responding over whenever they have an unruly person in the ER, or whenever they have somebody that needs to be, or that's committing a crime in or near the hospital, whatever. So the National Guard can provide a team that could be dedicated to that area to help minimize the number of times. Then they have full law enforcement powers, but they're there as more of a crowd control and traffic unit that can help keep me from having to send a regular police officer over there to deal with those things that would result in them potentially being exposed. So it's all part of a longer term strategy. I hope at the end of the day, we say, gee, sorry we called you down here. Sorry you deployed. Now, this National Guard unit, if it's approved, I haven't gotten the final word that it's been approved, but if it is, it'll be a small unit. It'll be just, a couple of people, several, probably 4 at the most. And more their role will be to provide us support, but to also be prepared to start the logistical movements. If a bigger, if my entire department goes down and the National Guard or the state police has to come in and take over the community caretaking function, they'll be in a position to be able to get that mobilized quickly. So it's all about preempting potential problems. It's not about, we can't handle it. Right now, we can handle it. Right now, we're doing things to preserve our officers' health. We're doing things to minimize the contact that the officers come in with the general public, yet still provide the services that are expected. And I'm hopeful that will be successful. But I'm not going to sit here and not take these extra steps, because I know, as hopeful as I am, I know sometimes they don't work. So we're just invoking every potential layer we possibly can to be prepared in case this thing goes really south. I'm optimistic that we're ahead of this curve, but that's just me as a police chief talking. And I think that's because we've put in some very strict measures that have been, for the most part, adhered to by most people. I think it's made a big difference. I think it will. Now, we'll wait and see if the medical professionals back me up on that. We'll wait and see if the cases that start coming in more and more and more sustain that assessment. But I'm optimistic that because everybody's been doing so well, that we've been we're getting ourselves ahead of the curve.
That's excellent information, Chief. You really hammered it all out. You really covered everything that we really needed to know. So I really wanted to say thank you for spending your time today, giving us these good tidbits of information. And we look forward to being ahead of the curve as well. So I really appreciate it. Thank you so much.
Okay, Roberto, I want to say thanks to you too, because your advice and counsel and Libby Gibson's leadership has really made this a team effort. And so I think the community needs to know that it really is a team. It's really been designed with the intentions of doing what's best for the community, even though it's had impacts negatively on us. I personally have, people that are affected by this COVID-19 that, it's tough, but we recognize you have to take tough measures to protect the greater good. So thank you.
Excellent. Thank you very much. But there was one or two more questions that we wanted to answer. So I'm going to go ahead and do a quick question and answer on those last three questions that I couldn't get to. Mainly, is there a way to test the people before they come to the island? Actually, there isn't. We aren't allowed to force people to get tested before they come to the island. It's a constitutional issue. But if they are showing symptoms or if they have any reason to believe that they may be infected with COVID-19, we are asking that they check in and get tested with a primary care individual. We are asking that travel to the island get limited. The other two questions, one is a clarification question about camping on the beach. That is correct. Camping is not allowed on the island. We do not allow camping on island as part of a bylaw. So though it is a nice suggestion, we unfortunately cannot do that. And then lastly is will the town be cleaning the streets at some point? And one of the issues that we're looking to do is we are currently deploying measures to get a disinfectant that wouldn't be too overwhelming to the environment, not like a pure bleach or anything of the sort. That sort of a disinfection is a little bit too damaging. So we're looking into alternatives so that we can disinfect things like the garbage cans, streets, sidewalks, the sides of buildings. Is it overkill? Possibly, but we are better safe than sorry in this case. And then one of the things that we're looking to do is, at this point, one last question, Mary, in the hypothetical would I discussion was very confusing. Yes, unfortunately, it was a little confusing. But we try to get information out as soon as we can and in trying to be a little bit more casual. So thank you, Mary. We do appreciate the information you are pushing out to us, and we do take that seriously. And then lastly, we do have a message from Cassandra D'Alberti from Fairwinds. We're looking to push out this information from Fairwinds, and we really appreciate it. Thank you.
Hi, this is Tess D'Alberti, the Executive Director of Fairwinds, Nantucket's Counseling Center. I'm happy to join you virtually and let you know what services are available for you and your family at this time, as well as some opportunities to manage our anxiety during these COVID-19 times. I'm starting with our website, as you can see behind us. It is fairwindcenter.org. And up at the top, you'll notice a language capacity where you can translate this into Spanish, Portuguese, whatever language you need. We are proud to offer clinical services for mental health and substance misuse, regardless of ability to pay, accept all insurances, and we'll be able to slide down to zero for you. If you're interested in what services we have, you would hover over this tab here and click to learn more. What we wanted to share with you is that as of last Tuesday, our entire clinic practice moved to a virtual practice, which means our doors are closed, but our services are very much open and a support to you. If you call 508-228-2689, you're going to be requesting services, and we're accepting new clients for all of our clinical services, including psychiatry, outpatient therapy, peer recovery coaching, community support provider, therapeutic mentoring, and a virtual in-home therapy for your child. We also have our court-ordered services all available to you. What we've done is we will be sending you a virtual link. It is called GoToMeeting, and will be emailed to you where you can access it from your smartphone or your computer. Our clinicians will work hand over hand with you to find a time that works for you. And we can be creative in problem solving how to connect for that individual appointment, whether that's going for a walk virtually and seeing one another, sitting in your car for some privacy, or scheduling an appointment outside of work hours that work for you. So maybe 6 o'clock in the morning or 7 o'clock at night, we will end up making time that works for you and your family. While GoToMeetings is the HIPAA secure virtual platform we are using, we also want clients to feel comfortable in a virtual platform that feels comfortable for them. So that could be FaceTime, WhatsApp, Zoom, or a telephone call. Maybe that's the easiest way to connect during these times. And if you're comfortable with it, we're comfortable with it. Again, we are providing clinical services to you and your family. We're taking new clients, and we're available virtually for you. The one program that we don't have virtual at this moment is our walk-in clinic. And that was previously Monday through Friday from 5 to 6. What we've done based on client need is we've moved this now to a virtual support group, which means no appointments necessary, no paperwork to fill out, and you can dial in from the telephone or your laptop from home to get clinical support. Starting April 6th, Monday, from 5 to 6 through the work week, you will use this hyperlink, which can be available to you on our website, and Instagram, or on Facebook. And it's a hyperlink that's live and links you straight to the group, which is great. And we're just going to go over what those groups are. On Mondays, we have Creating Calm. This is really relevant in these COVID-19 times of dealing with anxiety and stress, the unknown, and how to come up with some real techniques to manage that. Tuesday is Anchoring the Day with Your Child. We know that those parents and caregivers at home are in a new realm of trying to work remotely and manage their children while the schoolwork is virtual or self-taught. So we're going to come up with some behavior modifications, some structuring, some techniques that clinicians can help you with. Wednesdays is Healthy Choices. We know that with too much time on our hands, it can be troubling for any of us. This is really focused on keeping your recovery first and foremost, your top priority, whether that's related to substance use, eating, or maybe behavioral choices. Thursday, Being Heard and Listening. We know that this is, again, uncharted territories where all the roommates are home at the same time. Both parents are home at the same time with their kids, that there could be opportunities that we could help teach you how to avoid conflict and arguing, and really make sure you're slowing down and hearing each other to avoid these patterns of behavior that end up being something we can learn and correct from. The last one is Getting Back to Sleep. Anxiety's twin sister is depression and insomnia. And we know that when people are waking up at 2, 3 o'clock in the morning, tossing and turning, it can be overwhelming. And we want to give you some really concrete tips and some techniques to get at what's keeping you awake and how to get back to sleep. I want to remind everyone, these are completely free virtual groups. You do not have to be an ongoing client of ours, or you could, and we'd be happy to offer this virtual connection to other people in the community that are really learning to cope through these challenging times. Starting Monday, April 6th, from 5 to 6, Monday through Friday, you can click this hyperlink and you'll go straight to our virtual groups. It ends up being a great support for anybody right now, and it can supplement you with your private therapist or your own 12-step program or your own family supports. It's just another way to get help. I want to remind everyone that our doors are open and that we're finding ways that we can support you, whether it's by telephone or through face chat, WhatsApp. We want to be able to help. The other thing that I can help with, and Channel 18 is kindly offering a little bit more supports for, is real tips and techniques of how to deal with anxiety as a whole. It's a common condition. It's kept us safe for hundreds, if not thousands of years. And there are things that you can do at home to help yourself stay sane during these unknown times. Many great reliable sources are online for you. And here's just a couple of them that I can think that could help any of us. When you Google, and you can use Google Scholar or Image, there are lots of calming techniques that we know, but we also know, like a muscle, when you practice them, they get better and you get more benefit from them. We know limiting caffeine and alcohol during these times is important because they're amplifying intense emotions and can cause that anxiety to double over into what feels like panic. Getting outside and getting vitamin D and exercise is really important for all of us. So with social distancing, you can use those beautiful open spaces with those 6-foot difference between other people and get out and get moving. We're going to go over later today some grounding techniques and deep breathing techniques, but we also want to know that we can do a lot of self-talk of we're all doing the best we can. We're all reaching out via telephone to support one another and give back to one another. We also know that if we choose a positive attitude, even if it's hard to do, it can help in a moment. The other really basic things that all of us forget about during times of unknown is eating, drinking water, and sleeping, those basic things that keep us healthy and well. It is very common when we see clients that are really struggling with depression, anxiety, we'll say, how are you sleeping? 2 or 3 hours a night? No, I don't really drink water, and I haven't eaten today. If our body's not well taken care of, our mind is not going to be well taken care of. Fairwinds is really hoping to teach and educate people some basic clinical well-being tips that any of us can benefit from so that mental health services will be proactive and preventative. So if you can see this slide behind me, these are just a few of them that we want to go over. In upcoming video sessions, we're going to do one by one. We're going to start some guided meditation and imagery. We're going to try some progressive muscle relaxation. We're going to try some deep breathing and learn about how the brain responds to anxiety and how it goes into overdrive and how to bring it way down and calm each other down. So again, we want to let you know that while our doors are closed, our services are very much open. Fairwinds is here to help your family. We do know that clinical treatment works, and talking to someone and reaching out to help is going to help each and every one of you stay mentally healthy and well. If you have any questions, if you have any concerns, please call us. 508-228-2689. And our website has a lot of information on there as well as our social media following. But when in doubt, let us know. Wishing you and your family the very best.
Thank you to Sandra and Fairwinds for the hard work that you're doing. Before I close tonight, I would encourage people to use the social services I mentioned tonight. The links will be available on nctv18.org. And just look for the date of this broadcast in the NCTV news section. Please share with your friends and family as these services, such as Elder Services of Cape Cod and the Islands, Nantucket Food, Fuel, and Rental Assistance, Health Imperatives, and others, count on our support to help those most in need in this trying time. We all know from firsthand experience that Nantucketers come together to support each other. We will continue to provide you with updates on the coronavirus and impacts for Nantucket. Here's a reminder that starting next week, Nantucket Pulse will debut wellness shows from our local health professionals on Channel 18 and nctv18.org. Please share this with friends and family. We are in this together. It's important that communications remain in place as events continue to unfold. It's crucial to get the facts from your local news sources such as the Enquirer and Mirror, 97.7 AC-FM radio, and NCTV Channel 18. Thank you. I am Roberto Santamaria, your Health Director for Nantucket.